presenting my paper from the Journal of Magnetic Resonance Imaging called Diffusion Gradient Nonlinearity Bias Correction Reduces Bias of Breast Cancer Bone Metastasis ADC Values. Diffusion-weighted imaging is increasingly being used for treatment response assessment in bone metastasizing cancers. This is mainly because changes in ADC values can provide signs of disease response or progression. However, ADC values are not homogeneous across large SI field of view due to diffusion gradient nonlinearity bias. So what is diffusion gradient nonlinearities? Well, it's systematic bias in ADC values, which is caused by the fact that diffusion gradients are inherently nonlinear, which causes spatially varying encoding. The bias is specific to the gradient system and it varies across vendors. This causes ADC values to drop in the superior-inferior direction while increasing in the right-left and AP direction. The bias increases with the offset to the scanner isocenter. And here you see the bias from a diffusion phantom, where you see the bias increases with increased distance to the isocenter. So the purpose of this paper was to answer the following questions. Can we correct for diffusion gradient nonlinearity ADC bias in the SI direction? Can we correct it in breast cancer bone metastasis using a clinical DWI protocol and a correction algorithm on the MRI system? The correction algorithm used was based on the work by Malyarenko and Chenever, which you can find here. And lastly, how much can we increase the SI field of view without increasing diffusion gradient nonlinearity bias? So we started by using a diffusion phantom to test diffusion gradient nonlinearity correction against reference ADC values. Here you have an ADC map of the phantom, which contained 7 vials, which were 5 cm long and contained 30 milliliters of aqueous solutions of polymer, with concentration ranging from 0% to 20%. This corresponds to ADC values ranging from 1.1 to 0.6. The diffusion phantom was placed with the vials parallel to the B0 field in the center of the scanner. Axial DWI images was obtained and the table was moved 5 centimeters. This was repeated 7 times so that we got 35 centimeters of continuous vials in total. From the B50 and B800 images, we created ADC maps with and without diffusion gradient nonlinearity correction. On each ADC map, a 3.75 square centimeters rod was placed in each vial, and the mean ADC value was measured. To test if the diffusion gradient nonlinearity correction could also be applied to real patients, we recruited 23 women who were receiving treatment for bone metastasizing breast cancer. They were all being followed with MRI of the spine as part of their treatment response assessment. We performed DWI in 2 continuous reference stations and placed 1 overlapping measurement station with its isocenter where the 2 continuous stations met. This means that we had 28 centimeters with 2 stations with different SI offsets. From the B50 and B800 images, we created ADC maps with and without correction. Here we have a sagittal T1 weighted image that shows multiple metastases in this patient's spine. And here we have, this is the same metastasis. And on the B800 image, we drew a 2 square centimeters ROI, which we copied to the ADC map and measured the mean ADC value. And here we have our MRI protocol. We used a DWI with stir FATSAT using B0, B50, and B800. We had 5 millimeters slices with no gap, and our field of view was 28 centimeters in the SI direction for the patients and 35 centimeters for the diffusion phantom. In the diffusion phantom, we calculated percentage ADC bias as measured ADC minus the isocenter ADC divided by the isocenter ADC value. Then we calculate the percentage ADC bias at 14 centimeters SI offset and 17.5 centimeters SI offset. We also calculated the SI offset where ADC bias reached 5%. In the patient, we also calculated percentage ADC bias at 14 centimeter offset for both the uncorrected and corrected ADC values and compared them using a two-tailed t-test. And here are our results from the diffusion phantom. On the top row, we have the uncorrected ADC values for the 0% polymer solution, 10%, 20% with the different ADC values. On the bottom row, we have the ADC values after correction. As is pretty evident, we see that a lot of bias with increasing SI offset here, almost 40% at 18 centimeters SI offset. And this is completely removed after correction. There's a tendency towards a slight overcorrection for all polymer solutions. When looking at the numbers, we see that we have around 20% bias at 14 centimeter SI offset and around 30% at 17.5 centimeter SI offset. This is almost completely removed after correction with around 5% bias left. We also calculated the SI offset where we reached 5% ADC bias, and as you can see here for the three different polymer solutions, it's around 7.5 centimeters from the SI offset. This means that the station has to be no more than 15 centimeters if we want to have diffusion gradient nonlinearity bias under 5%. After correction, the station could be almost doubled in length. This is results from the patients. Each dot represents a bone metastasis. And here are the data from the uncorrected bone metastasis ADC values, and here after correction. And we see here that the bias is almost completely removed. There's also a slight tendency towards overcorrection for the bone metastasis ADC values. And the numbers ADC bias reached around 19% at 14 centimeter SI offset. After correction, this bias was reduced to 3.5%, which means that 82% of the bias was removed after bias correction. So in conclusion, online diffusion gradient nonlinearity correction is robust across several clinically relevant ADC values as shown in the diffusion phantom. Correction reduces bias of bone metastasis ADC values by 82% at 14 centimeter SI offset. It allows DWI station lengths to be increased from less than 15 centimeters to almost 28 centimeters in the superior-inferior direction.